Postpartum depression. Postpartum depression, or PDD, is a type of depression that occurs in women after giving birth. It is a serious mental health disorder that can affect a mother's ability to care for herself and her baby. Postpartum depression can occur any time within the first year after childbirth and can last for several months or longer if left untreated. PPD is linked to chemical, social, and psychological changes that happen when having a baby. During the postpartum period, new mothers may experience a range of physical symptoms, such as vaginal soreness, bleeding, breast engorgement, and fatigue. Emotionally, they may feel a mix of joy, excitement, and anxiety, as well as feelings of overwhelm or sadness. Postpartum depression is a common mental health condition that affects some new mothers, and can occur within the first year after childbirth. PPD is characterized by feelings of sadness, anxiety, and irritability that persist for several weeks or longer and can affect a mother's ability to care for herself and her baby. The actual link between this drop and depression is still not clear. But what is known is that the levels of estrogen and progesterone, the female reproductive hormones, increases tenfold during pregnancy. Then, they drop sharply after delivery. By 3 days after a woman gives birth, the levels of these hormones drop back to what they were before pregnancy. The social and psychological changes of having a baby create an increased risk of depression. Most new mothers experience the baby blues after delivery. About 1 out of every 10 of these women will develop a more severe and longer-lasting depression after delivery. About 1 in 1,000 women develop a more serious condition called postpartum psychosis. Also, dads aren't immune. Research shows that about 1 in 10 new fathers get depression during the year their child is born. If you have postpartum depression, it is not because you did anything wrong. Experts think it happens for many reasons, and those can be different for different people. The causes of postpartum depression, PPD, are not fully understood, but research suggests that a combination of physical, emotional, and social factors may contribute to the development of the condition. Some common risk factors for PPD include living alone, family history of mood disorders, limited social support, having a history of depression or premenstrual dysphoric disorder, a history of depression prior to becoming pregnant or during pregnancy, age at time of pregnancy, like, the younger you are, the higher the chances, uncertainty about the pregnancy. The more you have children, the more likely you are to be depressed in a later pregnancy. Going through a tremendously stressful event, like a job loss or health crisis. Having a child with special needs or health problems. Having twins or triplets. Marital dispute. Despite the fact that postpartum depression has been known about for a long time, many experts believe it isn't being properly diagnosed. As knowledge about postpartum depression grows, more healthcare professionals are looking for risk factors in their patients as early as their first prenatal care visit. The signs and symptoms of postpartum depression can vary from person to person but may include 1. Feelings of sadness, emptiness, or hopelessness that persist for more than 2 weeks. 2. Loss of interest or pleasure in activities that were once enjoyable. 3. Changes in appetite, either eating too little or too much. 4. Difficulty sleeping, even when the baby is sleeping. 5. Feeling tired or having little energy. 6. Feeling irritable or angry, especially without an obvious reason. 7. Difficulty bonding with the baby. 8. Feelings of guilt, worthlessness, or inadequacy as a mother. 9. Difficulty concentrating or making decisions. 10. Thoughts of harming oneself or the baby. Some of these symptoms are common in the postpartum period, and it is normal for new mothers to feel overwhelmed or have some difficulty adjusting to life with a new baby. However, if these symptoms persist and interfere with daily life, it may be a sign of PPD and professional help should be sought. If you or someone you know is experiencing symptoms of postpartum depression, it is necessary to seek professional help. Here are some steps you can take. Talk to your healthcare provider. Schedule an appointment with your healthcare provider as soon as possible to discuss your symptoms and treatment options. They may refer you to a mental health specialist or prescribe medication if necessary. Reach out for support. Talking to a trusted friend or family member about how you are feeling can be helpful. Additionally, support groups for new mothers or those with PPD can provide a safe space to share experiences and receive emotional support. Take care of yourself. Self-care is an important part of managing PPD. Getting enough sleep, eating a healthy diet, and engaging in physical activity can all help improve your mood and overall well-being. Consider therapy. Talk therapy, such as cognitive behavioral therapy, CBT, can be an effective treatment for PPD. A therapist can help you identify negative thought patterns and develop coping strategies to manage your symptoms. Be open to medication. In some cases, medication may be necessary to manage symptoms of PPD. Talk to your healthcare provider about the risks and benefits of medication and whether it may be a good option for you. Postpartum depression sometimes goes away on its own within 3 months of giving birth. But if it interferes with your everyday life at any time, or if the blues last longer than 2 weeks, you should seek treatment. About 90% of women who have postpartum depression can be treated successfully with medication or a combination of medication and psychotherapy. A support group may also be helpful. In cases of severe postpartum depression or postpartum psychosis, hospitalization may be necessary. Sometimes, if symptoms are especially severe, electroconvulsive (ECT) therapy may be used to treat severe depressions with hallucinations or delusions or overwhelming suicidal thoughts. It is best to seek treatment as soon as possible. If it's detected late or not at all, the condition may get worse. Also, experts have found that children can be affected by a parent's untreated PPD. They may be more prone to sleep disturbances, impaired cognitive development, insecurity, and frequent temper tantrums. While you're recovering from postpartum depression, you'll probably see an improvement from month to month. Be aware that your symptoms may flare up before a menstrual period because of fluctuations in your hormones. Remember, PPD is a treatable medical condition, and seeking help is a sign of strength. With the right treatment and support, you can overcome PPD and enjoy motherhood.